The management of the pes cavus foot has presented significant problems for the clinician in terms of choices that would balance this foot in the patient's daily activities. Most devices are actually made to control pronation, so something that is directed to redirect the foot into pronation has not really existed for the clinician. The Vasyli device has been created to balance many of the structural abnormalities that we saw in the assessment previously. When we look at the device from a lateral view, you can see that the forefoot is actually lower than the rear foot. This helps to balance the forefoot equinus that many of these patients have, and the device is actually shipped with a small heel lift, which can be added to the device. In a regular shoe that has a small heel, this may not actually be necessary. Some of the other structural faults which are balanced in the device have to do with the first metatarsal, which we saw on the pes cavus foot type is typically plantar flexed. With the plantar flex first ray, we created a relief area, which is this soft red piece of poron, as well as a significant indentation in the device to allow the first metatarsal to have an area to sink into and have relief to balance the foot. On the remainder of the forefoot, we have lateral posting, which means that it's thicker on the outside than the inside. And this lateral posting has been extended forward to the sulcus of the toes. And then we have creased it as well as vented it because this is a fairly significant thickness to the device, and the thermal indicator has been moved forward to allow the clinician to see when this particular part of the device will be ready for custom molding to the patient's foot. In addition to the venting, the creases also create a much more natural bend point to the forefoot of the orthotic device. In the arch area, we've excavated the typical firm arch area and created a much softer arch profile, which can still be custom molded to the patient's foot, but with a much less rigorous control of this particular area. In the rear foot, we have created a more neutral rear foot profile. Now, many devices are actually created with medial wedging to resist pronation, and in this particular foot type, since they are moving in that direction, we've taken away all of the varus correction or medial posting to create a much more neutral rear foot base for the foot orthotic device. Finally, if we look at the device and look at the fifth metatarsal region, you can see that we have an indentation to that area, as well as a soft pad to relieve the very prominent base of the fifth metatarsal, which is typically in the forefoot that has a more adductus position, going to be one of the more prominent areas of the foot. One of the beauties of the Vasyli foot orthotic device system is the ability to modify the device. Certainly the ability to heat mold the shell gives us a much more congruent posture to the foot, as well as a nice interface for the ground. But with that, we sometimes need balancing in the form of posting. One of the most common areas to get excessive motion has to do with the rear foot and the heel moving into excessive pronation. So when we see this, and we want to go beyond the normal support of the device, we can add additional correction by placing a rear foot post against the arch profile. And depending upon the length of the device, we may have a bit material left over, but we line this up on the medial side of the arch profile at the very proximal end, and then just extend that around. You may see that this then extends a little beyond the shell of the orthotic device, and that can simply be trimmed with scissors to make it congruent and flush with the end of the orthotic device. The problems are not always in the rear foot, however. There are some folks who have late pronation, things such as a forefoot varus, where we need our control closer to the front of the foot. So a forefoot varus post is going to be thicker on the arch side and thinner as it goes out to the outside. The placement of the post should be right behind where the first metatarsal will hit, so that the end of the device would be placed somewhat like this, so that the medial edge of the device is flush to the medial border of the device, and then the adhesive is removed and the device is simply placed across the foot so that the foot can still bend freely in the forefoot, but is supported just behind that by the forefoot post. You may see there also will be a little bit of extra material that can be again trimmed with simple scissors to make a nice flush contour to the medial profile of the device against the shoe. Now, some folks have a supinatory problem and have a tendency to roll to the outside, so we do also have lateral posting. This would be placed behind the fifth metatarsal head and again placed flush against the lateral side so that it does not interfere with the natural toe break but still supports the metatarsal or forefoot region and keeps the foot from moving to the lateral side. Two other corrections that we can make through the device are a heel lift and metatarsal raises. The heel lift can be placed in the rear of the device to raise the device a bit higher in the rear foot than the forefoot. This is used for a variety of conditions. This can be used for leg length correction, as well as someone who has an unresolved equinus influence of their ankle, meaning if they have an ankle that simply doesn't have enough dorsiflexion. By placing the heel lift on the device the way that we have here, that allows the ankle to function in a position of more plantar flexion. Obviously, with leg length, we would want to try to make sure how much correction we want. One of the nice things about the Vasyli heel lifts is that you can vary the correction by where you put the device. If we want the full correction, we put the heel flush with the device. If we want a bit less, we simply move it backward, and then we trim this excess material off the end. The final addition to the foot orthotic device that can be useful is an extra support to the metatarsal area. This is a metatarsal raise, and again the adhesive backing would be removed, and this would be placed on the orthotic device so that the front edge actually fit flush with the edge of the device. This creates a nice metatarsal raise which supports the shafts of the metatarsals, creating a bit more of a doming to the foot and relieving some of the excess pressure that often occurs in the metatarsal area.